Good afternoon. Thank you all for joining us. We are here for a webinar on coronavirus COVID-19 agency preparedness and prevention. We want to go ahead real quick and just provide some general housekeeping so that way everyone is aware of kind of where we are with the mic. It seems like there may be a mic that's unmuted for some odd reason. Please mute your mics. All mics should already be muted, but I am hearing some background noise, so please mute your mic, please. Please note that the webinar is being recorded and that any question that we don't get to during the webinar, we'll make sure to address then after. But again, thank you so very much for joining us, and I want to turn it over to our President CEO, Sister Donna Markham.
Hi, everybody, whether it's morning, afternoon, or night, depending on where you are on Earth. Welcome to this webinar, and I know that everybody is concerned. No one has all the answers, but we are very blessed today to have with us two of our leaders here at CCUSA who are going to address the issue and then be open for questions. Of course, most of you know our wonderful, extraordinary Kim Burgo, who is our Vice President for all of our disaster operations. And some of you know our new Chief Officer for Population Health, that's Lorraine Bell. And Lorraine, in addition to being with us on staff, is a nurse, and she's also an attorney. So we have some very wise heads sitting in this room, and although all of us are in the same predicament of not knowing exactly how to respond because of the unpredictability and uncertainty, hopefully today we can have an opportunity to learn a few things and air some questions and get some strategies in place for handling this as it develops through our communities. So Kim and Lorraine, this is all yours.
Great. Thank you very much, Sister Donna. This is Kim Burgo. Welcome to our webinar this afternoon. We have a lot of information to cover in just an hour, and we have a record number of people who have signed up to be on this call. So we will keep this clear and concise so that everyone can receive the information they need and also go on with their day at 3 o'clock. Okay, so welcome again. We will take some time today to review some of the resources that are out there. We'll talk about the health and science, the basics and that you need to know. We'll go through some agency planning considerations, particularly as they concern your continuity management plans as an employer, as a community leader, and also as a service provider. We have Catholic Charities of Acadiana we're going to highlight this afternoon. Then we'll introduce a preparedness checklist and then have questions at the end. So with this, I'm going to turn it over to Lorraine. She'll start us off.
Yes, hi everyone. I'm Lorraine Bell, and I'm going to share with you some basic information about the coronavirus. I know that it's a very important issue right now, and every day it's just evolving. We go to bed and we hear one thing, and we wake up and we hear something else. So what I'm going to share with you for the purpose of this presentation is information that you may have heard and maybe some particulars that you may have not, but it's all to set the stage for the presentation. So this slide here, just want to give you some information on some resources that you can access to follow up and to keep abreast of all the things that are happening with this particular epidemic, information that would be useful to your agency as well as to you personally.
Yeah, this is a map, if you're not familiar with it, put out by Johns Hopkins. It is a live interactive map of the current coronavirus cases. You will see I loaded up this map yesterday afternoon, and the total confirmed was 94,250, and just before this webinar, the total had gone up to almost 97,000.
Okay, so I'm just going to jump into a few slides with some, once again, basic information about the coronavirus. So coronaviruses are a large family of viruses that can cause illnesses and in animals and well as in human beings. And in humans, several coronavirus viruses are known to cause respiratory infections ranging from the common cold to more severe diseases. COVID-19, which is the coronavirus that is now causing the epidemic as we know it now, is impacting human beings across the globe. And it appears that this particular virus is more virulent than previous coronaviruses. COVID-19 it spreads from person to person through small droplets from the nose and the mouth, which then spread when an infected person either coughs or exhales. Um, the droplets that come from the infected person land on objects and surfaces around that person, and then other people catch the virus by touching those objects and surfaces, and then they touch their eyes and their mouth and their noses, and that's how one mode of infection happens. And then people can also catch the virus if they breathe in the droplets from the person who is infected, if that person coughs on them, or if that person exhales droplets. So, and this is why it's important, according to the research and the information that we're getting from the CDC, to stay within 3 to 6 feet away from someone who is displaying symptoms of a respiratory infection. So it's not certain how long this particular virus survives on surfaces. However, coronaviruses in general may persist on surfaces for a few hours up to several days. And how long it lives on the surface depends on the surface itself or the conditions, such as the temperature and the environment, the humidity. But if you think that there's a surface that you're working around that may be infected, then you just can simply clean it with a disinfectant wipe that kills viruses to protect yourself and others. A Lysol wipe or something that has Clorox or bleach in it would be effective. The incubation period for COVID-19 ranges from 1 to 14 days. And what I mean by incubation period is the time in which a person is infected with the virus to the time when symptoms begin to display. And there are reports that individuals transmitting the infection to others, that there's sometimes they can transmit that infection before symptoms even show up, which causes a lot of caution. But in any case, when individuals are returning from areas where there's a large epidemic where there's an epidemic, the guidance is that individuals should be quarantined for 14 days. We also know that older people and persons with pre-existing medical conditions appear to develop serious illnesses from the virus more often than others. And that is not to say that children and younger people cannot, develop serious illnesses if they are infected with this particular virus. But what we are saying is that these older people and people who have pre-existing conditions are at risk. Pre-existing conditions include diabetes, cancer, kidney disease, heart disease, lung disease. And so far, right now, there is no vaccine and no specific antiviral medication to prevent or treat COVID-19. So this next slide, there have been a lot of questions. Once again, this is basic information, but information we think is useful. Comparing the COVID-19 virus to the flu virus. So this particular chart does that comparison to highlight some of the similarities and the differences. So the cause, of course, of the two infection viruses are different. One is the novel 2019 coronavirus, or SARS-CoV-2, and the flu is caused by the different types and strains of the influenza virus. As you can see on this chart, the symptoms for the two infections are similar. You have fever, cough, body aches, vomiting, and other GI problems. The symptoms can be mild to severe to even fatal, and the symptoms can result in pneumonia. Transmission from person to person via droplets is a way for it to spread in both the coronavirus and the flu. However, spreading through the airborne route for the influenza is not a route of transmission. But with coronavirus, we're not sure. And this causes one of the, I guess, the epidemiological challenges while the research and is going on to sort of nail down how all the ways in which coronavirus is spread. Um, that creates a big challenge. Once we are able to narrow that down, I think some of the precautions and ways to treat and to contain and to control the spread will be better understood and handled. Transmission via person to person before symptoms arise is also common with both coronavirus and with influenza. The treatment. Neither one of the viruses are treated with antibiotics because they're viruses. But with both, treatment of the symptoms, the fever, dehydration, aches and pains, and GI symptoms are treated with those. Also, antiviral medications are not available for the coronavirus. There's no cure and there's no medications to shorten the duration of the infection. For the flu, there's Tamiflu as well. Okay. So and then prevention for both. Frequent hand washing, covering your mouth when you cough or sneeze, and limiting contact with individuals who are infected, and staying at home when you're sick are the ways in which we talk about preventing the spread of both of these viral-based infections. Once again, continuing to look at both these viruses, we see that with the coronavirus, approximately right now, as of this morning, about 97,000 cases worldwide, 160 in the U.S. as of today. And you see the numbers for the flu. Deaths for the coronavirus worldwide is about 3,300, 11 here in the United States as of today. And the flu over the time and over the years, we can see what the numbers are. One of the things, just going back to the previous slide, I wanted to highlight on this is that with the coronavirus situation, it's changing, pretty rapidly. And since this is a new virus and people don't have immunity to it, and it may be months and months away before we get a vaccine. And as I mentioned before, doctors and scientists are working to estimate the mortality rate of the coronavirus, but at present, it is thought to be that the coronavirus mortality rate is higher than that, will be higher and will be higher than that of the flu. So personal protections, washing your hands often with soap and water for 20 seconds, especially after going to the bathroom or eating, or blowing your nose and coughing. We have been told this over and over again, but it's tried and true. This is what works to prevent and to protect yourself personally. Soap and water are not available. For hand washing, you can use alcohol-based sanitizer with at least 60% alcohol in it. But let's just be clear: hand sanitizers kill many bacteria, but it kills very few viruses. So, but it doesn't kill the coronavirus. But we still advise to use that when soap and water are not available. And always wash your hands with soap and water when your hands are visibly dirty. Um, Another note on that piece: bacteria have many fat molecules in their outer wall, and when we use soap to wash our hands, the the soap then sort of pulls away that those fat particles from that wall and basically kills the bacteria. With they're usually encased in protein um, sheets, and they too have fat molecules in them. And so when we wash our hands, particularly when we use soaps that have grease dissolving properties to them, they disrupt the sort of functions of the viruses and of the bacteria. And so that is very, very helpful with washing these off of your hands. Um, so I just wanted to say that. Um, Continuing with personal protections, covering our mouths when we sneeze, avoiding touching your hands and mouth with unwashed hands, um, and cleaning and disinfecting surfaces and objects that people frequently touch. The CDC doesn't recommend that people use face masks if they are well to prevent the respiratory diseases, including the coronavirus. But face masks should be used for people who show symptoms of the coronavirus to help prevent the spread of disease to others. And particularly using face masks when you are a healthcare worker working in close quarters with people who may be sick. And of course, personal protection also includes staying at home when you are sick. So looking at this slide, just want to highlight, some of the common symptoms with the coronavirus. So fever, developing a dry cough after 2 to 7 days, mild breathing difficulties at the onset of the infection, GI symptoms such as nausea and vomiting, and then general body aches. And these symptoms, once again, can be similar to what we see with the flu. But when you do have these symptoms, what's important is that you stay at home and then you initiate getting medical care. When you do seek medical care with these symptoms, chances are the doctor will screen you, or your healthcare provider will screen you for the coronavirus. And if via the protocol that is used, there is a need to test you for that, then testing would include swabbing your throat, swabbing your nostrils, and if you have a productive cough, getting a sample of that sputum and sending it off for testing. As I was reading, it seems like testing results generally can be back in 24 hours, but can take as long as 72 hours, depending on the location of where your provider is and such. What else can you do? You can separate yourself from others in your home. You can call the doctor's office before you go in order to let them know that you're coming and to protect, and so that the doctor's office can prepare for you. Wear face masks if you have these symptoms. Cover your mouth when you cough or sneeze. Avoid sharing personal household items with individuals that you live in. Clean your hands often. Clean all high-touch surfaces daily, and monitor your symptoms. And then when your doctor and you consult with one another, you can determine how long you can, when you can discontinue home isolation. So creating a safe and well work environment. Once again, always promoting personal protection with all staff and volunteers. Some of the things that we mentioned before. Some things that might be unique to Catholic Charities and where we work and who we serve. We may want to set up hand washing stations at shelters and soup kitchens. And we'll review and share some of the practice disaster emergency response plans with staff. And then continually, daily, monitor the CDC and your state and local and public health agencies for guidance and alerts on this epidemic. So with that, I'll turn it over to to Kim.
Thank you very much, Lorraine. I think it's important to note that I'm sure that many of you have heard a lot of this information before, but as we move forward, I think it's important that we now take that information and explore why it would be important for a Catholic Charities agency to know this information and consider it as they are developing their plan. Okay, so I think that we've certainly found over the last couple weeks that the coronavirus is more than just a virus. It has spread into every aspect of our lives. I know that people are thinking about their travel. Do we travel? Do we not travel? People are considering, whether they get packages from um, out of town, out of country. I know that my own daughter is questioning whether she should order from Wish anymore because that, of course, comes from China. There's, of course, this global supply chain. If we all stop buying, what's going to happen? Of course, that affects the economic market, and it goes without saying vulnerable populations. So how do we really move forward and plan for this? Well, three steps here. First is it's really important to engage a whole community approach. I know that many of you have heard me say this before, but truly there is no single agency or organization that can prepare for this pandemic by themselves. And whether it's a pandemic or a disaster, no one organization will be able to meet the needs. So in some ways that's a good thing because you, as Catholic Charities leaders, can really set the stage and get out there. You can be that convener and work with leaders within your community to really safeguard the population of those that you serve and make that part of the mitigation of spreading and exposure to the virus. I will tell you though, without that whole community approach, then the vulnerable do become more vulnerable. Step two is that you've got to integrate your plan. I think what's interesting about this one is that unlike a hurricane or a tornado, where you can plan for its the landfall or the event to happen, in this case, we don't know where coronavirus is going to strike. So you could plan and certainly create your service provisions, but other people on the other end are also planning as well. So while you're planning for absenteeism, let's say, and you want to make sure that you're going to stockpile on office supplies so that you're not out of them when there's people out of the office. Well, guess what? The people who are selling you those office supplies are also planning for people to be out of work. So this could be a real dilemma if we don't plan carefully. It takes a lot of collaboration and connectivity to be able to come up with a plan that will, at least that you have moving forward. But I can tell you that a lack of effective planning, it is going to affect your business. It's going to interrupt what you do. It could result in resource shortages, both human and financial, and could be legal responsibilities. What do I mean by that? Let's say that you have staff who are working with clients and a client becomes infected, but the agency did nothing in their plan to prepare staff for what to do for that infection. I'm sure that that employee now has a HR complaint that's pretty valid for legal means. Also, consider the dynamics. The dynamics of a pandemic are different. It doesn't go away. It's going to happen, and then it's going to happen again, and then it's going to happen again. This is not going to be done by April 15th. It's going to continue through the summer, and will likely continue into the fall as we move forward. Of course, the weather changes things. As Lorraine said, it depends on the temperature of things, what's going to happen when the coronavirus meets warm weather or cold weather, how could that spread? It is unpredictable. We certainly have to prepare for economic, humanitarian, and society consequences, but we have to be able to create plans that are flexible and will carry you for the next few months, not the next few weeks. You have to look at really identifying who you depend on, who do you rely on in your work, and work with them if needed to create your plan. Okay, so then we take a look at business continuity management. That's what all of this leads us to. How are you going to structure yourself? I know many of you do great work. You perform miracles on a daily basis. You are the most awesome social service providers I've ever seen, but you also run a business. And as running a business, you really need to take some business administration things into consideration. So the first thing that we want to take into consideration is a continuity of operations plan. You want to make sure that you have everything that you need in place in case something happens. And of course, this could happen for a pandemic, it could happen for a tornado, it could happen for a flood. Whatever it is, you've got to make sure that you have this plan in place. The plan has to manage your business interruptions, your loss of staff, your administrative dysfunctions, and any kind of disruption in your resources. Some of the critical assumptions that you have to take into consideration when you're developing this plan, particularly for the coronavirus, is you do have to take into consideration the infection rate and the fatality rate and how that is all playing out nationally, but also maybe in your state or in your locally in your city or town. Your population susceptibility. Are you working in a population that may have a lesser access to health care? How is that going to spread in that population versus a city where there's more access to health care needs? Your worker absentee levels. You know, sometimes it's easier for larger organizations to say, okay, you 200 can stay off the work, and you know the 800 of us will pick up that slack while you're gone. But what if you're a small agency that only has two? Then what do? So you really have to make sure that you have plans in place that consider worker absenteeism levels and also the duration of the pandemic. Like I said, it's not going to happen by April 15th. It is going to continue, and it is going to continue in waves, and we have to be ready for those kinds of circumstances. This is a big warning. Unlike your programs that you may have in a continuity of operations plan under a natural disaster, this is going to require different measures of action under different programs. Your programs that have to deal with senior living or grandparents, connectivity, whatever you have for those that are older is going to be more susceptible. You have programs where families are there. So how does that take place? Congregate care, how does that happen? All your programming needs to have its own continuity management plan. You can't just do it under one roof. Everyone has to have a continuity management plan, and it has to all be coordinated through your agency. Part B in having a business management plan is certainly developing a plan, an emergency plan for staff. All staff should have access to accurate and up-to-date information that's easy to understand about the coronavirus, but also about any other disaster or natural disaster or emergency that could happen in your office. So it's not just about the coronavirus. It's also about anything else that could happen. What if you had an active shooter? What is that plan? Do staff understand that plan? What if you had a tornado or a flood? In this case, we're talking about a pandemic. So I know people have looked at me before when I say business and continuity planning, and they go, "Oh, here she goes again." Well, let me tell you, this is how it's going to play out. This scenario is not so far-fetched. So you have a client who the night before has celebrated with her family because her sister has come home from an overseas trip and is welcoming her home, and didn't know that sister was infected with the coronavirus, and therefore that client has become infected with the coronavirus. The client lives in a Catholic Charities transitional housing facility that your agency manages. And the next day, they decide to take public transportation to come to your Catholic Charities office to receive services. They get their services in case management and counseling, and then they stick around because your agency has a soup kitchen that they would like to get their meal in before they go back to their transitional housing facility and by public transportation. Okay, easy scenario, but guess what? The average person encounters 25 people on a given day. You going to work, you leave the house, you stop at the bank on your way home or the grocery store. In this case, public transit. And as Lorraine said, the coronavirus can stay on surfaces for up to several days, and the incubation period is 1 to 14 days. So how does this play out? This plays out because in 7 days before that person realizes that they're infected, they will have exposed others, a total of 175 people. And if those 175 people go about their lives for 7 days, that number has now grown to 30,000 people, and it spreads from there. Now, of course, this takes into account that maybe no one has washed their hands or no one's paid attention to Lorraine or anything else, and we just go about our lives. But the idea is there that this is easily can be spread, and it can be a very innocent act. You just don't know where it is. So part C in this business continuity management is about creating emergency plans for your clients. This is where it becomes really difficult because by the nature of who you are in your community, folks are going to come to you for assistance. It doesn't matter whether you're prepared or not. They're just going to come and they're going to wait at your front door for you to open, and they're going to want you to provide assistance right away. Yet you, as Catholic Charities, have to do that very delicate balancing act between being an employer who has an obligation to protect the health of their staff, but also being mindful that the vulnerable populations that you're serving also need assistance and also need to be protected. So this is where your plan needs to be well thought out. How are you going to do that? You can really make sure that those plans can safeguard clients from further contamination. What do I mean by that? Well, maybe you get somebody to donate a bunch of hand sanitizer or gloves or whatever is needed to make sure that your clients are educated, that they have the resources they need to stay safe and well. And also, and most importantly, as a community leader, you can collaborate with other organizations and other leaders in your community to identify strategies that keep the population of those you're serving in the forefront, that they're not forgotten, that they are also very vulnerable in this kind of situation. Okay, I'm going to stop there for a second and, oh, wait a minute, I forgot one, sorry. I do want to make a special note. For agencies that are working on the border, guess what? Your job is a little harder. If you didn't have a hard job enough, now you got to work with the other government. So if you are a staff person for Catholic Charities who is going back and forth across the border to provide services to those who are already marginalized, you will also need to take into consideration any laws or guidance from the country you are entering. So please just take that into consideration as you're moving forward in your plan. Okay, we were hoping that Kim Boudreau would come on, but she is not on. Kim, we reached out to Kim Boudreau in Louisiana because we had asked if she was sharing some information about her her facilities and how she's doing. She's not on.
No, it doesn't look as if, unless, I know there are some, participants who may be on the phone as a group. So if you are, Kim, on the line with a group or under a different name, just use the raise hand tool, and then I'll know to unmute your mic.
Okay. I don't see. Yeah. Nothing. Okay. Okay. Well, so I'll just read what Kim has already sent me. She says, here at Catholic Charities of Acadiana, we are washing our hands. We are more afraid of the flu and tuberculosis, but we have increased our normal precautions for disease prevention in our shelters and congregate feeding sites. We are following state and local emergency preparedness conversations, etc. We do hourly sanitation of our shelters and congregate feeding locations. People are sleeping 3 to 6 feet apart. This is a challenge in our men's shelter because we have 50 people over capacity and they are sleeping on the floor. We are averaging 100 people each night in that location. We have masks for people to wear if they have a cough or if they have compromised immune systems. We have gotten strict about staff coming to work if they're not well, and we have hand sanitizers mounted throughout all of our buildings. So that just gives you an idea. I'm sorry that Kim isn't logged on. We were hoping to include her in this conversation. Okay, finally, what we have is we've prepared a document for you called Pandemic Readiness Checklist. And this kind of takes into consideration many of the things that we've put out there and have been presented in this webinar and helps to bring them into a concise manner by which you can certainly move forward and start the planning process. And this takes a look at what you need to do as an employer, as an agency, what you need to do as a leader, a community leader with you and your partners, and what you need to do as a social service agency with your clients, okay? So, Simona, do you want to take a moment and just say how folks can access this?
Absolutely. So the way in which we would access it, for those on the line who are with Catholic Charity Agency, go ahead and log into your members portal. At that point, you'll want to go ahead and search for the resource section of the members portal where the various resources exist. And once you select disaster services, it actually will be the most recent resource listed since it was uploaded today. And also, you'll be able to see it probably on that main screen member portal in addition to being a handout on this webinar. So
how do they access as a handout on this webinar?
Very good question, Kim. So there's a dialog box at the very bottom underneath your chat, or above or bottom, where you can access all of the resources that go along with this webinar. And it's in a PDF fashion. You'll be able to just click on it during this webinar and actually see this resource that Kim is referring to, that you're referring to.
Great. We had gotten notice that Kim was logging on. Is she on yet?
Let's check.
Okay, well, if she joins on, then we will definitely make sure that she has a moment to speak. Okay? All right. So Many of you have already provided us with questions, so we wanted to take a moment while we have a few to be able to answer some of these before we end the webinar. So let's see here. One of the questions that we have here is Catholic Charities planning any public health or community health programming in vulnerable communities at this point? Great question. Catholic Charities USA wouldn't create health programs at the community level to begin with. And so that really is, we encourage your agency to do. And your agency may need to connect with state leaders, local departments of health and human services to be able to follow the guidelines that are specific to your area. I was talking with someone about this today and was very clear to say, hey, look, the needs for health and human services in Bozeman, Montana are not the same for Miami, Florida. And so you really need to follow the health and human service guidelines in your state. I know that if you try to go to the Health and Human Services website at the federal level, you're just going to be diverted into the CDC. But I did note that if you go to your state, you should be able to access local health and human services information and guidance. Lorraine, you got a question too, didn't you?
Yeah, and I addressed it in my part of the presentation, but I'll ask the question and answer it again. And the question is, one question is, do we actually know the ways the coronavirus is transmitted one person to the other? And what we know at this point is that there is person-to-person transmission via droplets. The spread of the virus through the airborne route is not very clear, and that's one of the big challenges. We also know that the virus can be spread from person to person sometimes during the incubation period when the person who is infected is not displaying any symptoms. But once again, that would be through droplets from coughing or sneezing. The scientists, doctors are doing the research to find out, are there other ways of this virus being transmitted? But right now, that is the one way that it is. The other question is, how long does it take for what's the incubation period? And again, it's 1 to 14 days, with some people displaying symptoms 5 days after they've been infected. And when people are returning from areas that have an epidemic, and they come back, they're usually put in some level of quarantine for the first 14 days when they come back to see if they have symptoms that evolve. So.
Great, thank you. Another question we had was, are there materials that we can use to educate clients? You know what? Those resources that we provided you at the very beginning have a lot of information and a lot of materials. There are so many materials. There is nothing that Catholic Charities can produce right now that would be any better than any of the professional health institutions that are out there providing this information. So we really encourage you to go online to the World Health Organization, to the CDC, to your state health and human services offices to be able to download that information. Let's see here, another one. How do we proceed if one of our clients tests positive without putting ourselves at risk of being exposed? Well, I I'm trying to imagine a scenario where you would be with your client when they test positive. And I think that that's, they don't have individual testing kits yet. I think that's something that folks are working on. But at the moment, if a client tests positive, then you want to make sure that they stay home, encourage them to stay home, or check with your local health and human service agency and see if there's any protocols for what happens locally if people were to walk into your office and be infected. So I think that's something that, again, has to be looked at the local level, and discussed there.
One of the other questions is, are there materials we can use to educate clients? At the beginning of the presentation, there are resources. The CDC has a lot of information that is readable, that is public friendly, that can be downloaded. They're in there on the coronavirus, not just for you to hand out to your clients, but also for you to use for your staff and have within your various agencies. Also, the WHO, the World Health Organization, also has materials that are useful as well. So you can access any of those links that are displayed on the presentation to get useful and up-to-date information.
And if you're an agency leader, I do want to really recommend that you take the course on the continuity of operations planning for pandemics. I know that our very own Brian Corbin took it here at the office just to see what it was about, and he walked away from it saying he learned a lot. So for Brian to do that, that I know that certainly there's great information in there for each of you. Okay, Simona has informed me that Kim Boudreau has joined us from Catholic Charities of Acadiana. So Kim, we were discussing about how your agency has taken some great measures in light of the coronavirus. And so we wanted to hear from you. You're the agency director. I'm here in Washington, D.C. So I want to hear from you. What have you done and how's it going? Maybe some of your challenges and what you've learned so far.
Good afternoon. Can you hear me?
Yes.
Okay, perfect. So we've taken a couple of steps outside of our normal protocols and am invited to share with y'all. And based off of the lack of data that we feel like we have on this particular virus, we're, I guess, just taking the protocols that we know to take. Some of the challenges is not knowing exactly how long the viruses live on surfaces or all the ways that it can be transmitted. So we're erring on the side of caution. And we tend to be serving population. Our clients have high rates of medical vulnerabilities. And typically, our folks can be resistant to safety protocols. And so that does sometimes present a challenge, when working with congregate living and in shelters and in soup kitchens. The way that we, are approaching this is, in some ways similar to how we, work within our flu season, is that we, whenever somebody becomes symptomatic, particularly with a cough and fever for this particular virus, we began to, take steps towards isolating them from the general population and trying to put them in a room away from others. We're following the recommended protocol of separating people at night at a minimum of 3 feet, but trying to separate people by 6 feet and rotating them, sleeping head to foot in our shelters. That does help give a little more space. It's not doesn't solve anything when we have 100 people in one building overnight, but we're doing the best that we can to distance people. We're also taking into consideration that our employees tend to be terrible at coming to work when they're not feeling well. And one of the factors that can lead to this type of behavior is lack of sick leave that they may have. And so we're in the process of implementing a disaster sick leave policy, amending our current disaster pay policy to include extending sick leave for staff during these heightened periods of time, and so that we can make sure that staff doesn't come to work whenever they're symptomatic, especially our new employees that haven't necessarily been vested a whole lot of leave. We want to make sure that if we have staff that are sick, they're not coming to work. We're also making an assessment of employees that may be vulnerable and have some health conditions, just to make sure that we're keeping an eye on them. We are also waiving the requirement for a doctor's excuse. Typically in our personnel policy, after 3 days of being out to return to work, you have to present a doctor's excuse, and we're going to be waiving that because we've seen the recommendation of people not going to the doctor, not being recommended to go to the doctor to seek care for this particular situation. So we are waiving that requirement in a further effort to try to encourage people to stay home when they're sick. Going back to the clients, we are implementing a screening for fever. We're looking for, we do have a medical clinic on our main campus, but we are looking for trying to source the thermostat, not the thermometers that you can put on foreheads as a way of doing screening for fever. We're making sure that all of our buildings have signage, such as hand washing signs over all of the sinks, and the cover your cough signs, just as reminders. We also have a problem with people spit often around our campus. So we're trying to educate our population about, those types of things. We do, on a regular basis, pressure wash the exterior of our property as part of our hepatitis prevention. We have discontinued pressure washing at this time due to this particular virus because of when you pressure wash, you can, I guess, as we call it, verspluting the water and possibly put some virus airborne. So we instead are using a mixture of Tide and bleach and spraying down the sidewalk and rinsing in the walls and rinsing it with a hose instead of power washing. And our staff is wearing protective gear. We're stocked up on cleaning supplies, wiping down our surfaces no less than 4 times a day. The recommendation is once every 3 days. We think that that's way too infrequent, but we're wiping down at least 4 times a day to 6 times a day. We're mindful that many of our clients are sensitive to bleach, and so we're using a hospital grade cleaning product to sanitize our properties. Being mindful that when you're sanitizing, the surface has to be wet for 5 minutes. And then we're distributing masks and making those available, especially if someone's symptomatic. When they're not in the rooms, we're recommending people wear their masks, especially if they have health conditions. We're partnering with our local Catholic hospital and trying to get some of these supplies from them. And that's kind of where we're at right now.
I think that's a great list, Kim. Thank you so very much. Very thorough. And I would encourage any other organization that may be, any other agency that may be on this call, if you have similar best practices, please, please, please share them. After we complete this webinar, we are pulling together all the questions and comments that have been made, and we will be sure to go through them and make them available as well. So this is your time. I know we don't have a lot of time to have everyone have an open mic to share amongst each other, but certainly we really do want to hear the kinds of resources that you have and the best practices. One final question before we go. So we received a question that's kind of 2-part. One is, what can we tell community stakeholders who are concerned that refugees are bringing in the coronavirus? Well, you can tell them that last year the U.S. government only allowed for 18,000 refugees to come in, and so certainly they were spread all over the country, and that's hardly, they're not bringing in the coronavirus. I think that the more you can educate, the more you can, again, provide information from your state and local leaders on the coronavirus itself, the spread of coronavirus, the more that you can eliminate that kind of stigma. Also, the other part of the question is, what do we do with the immigrant population that is undocumented and they're scared and they don't want to go to their doctor, go to a doctor to be identified? That is always a concern, even in a natural disaster. They don't want to evacuate. They don't want to be found out. And so I would encourage, if these folks are not coming right now, well, I should say this. Right now at the border, no one is getting across. So a lot of folks are on the Mexican side of the border. And I know that in the Hispanic community, they use something called health promoters. And it might be wise to check with the local government to see if their health promoters are available that can do some wellness checks, perhaps in the population as they are gathering in shelters and areas as they wait for their court date. So that might be something that you do. And on the U.S. side, maybe you can figure out a way, maybe have a health clinic to come and again do some sort of health wellness check, and so people feel more at ease that it's just a cough and not a virus, and then work with that client that if they do need extra services, to get some extra services in a way that they feel safe and protected. Okay, Brian, Brian Corbin is here, and I would love, Brian, do you want to say anything final before we wrap up?
Sure. First of all, thank you, Lorraine, Kim, and Simona. I guess as you think about this, especially those at Catholic Charities, remember that at least our national mission is to serve, to advocate, and to convene, and to use all three of those concepts in this whole process. You obviously serving clients as they need and be wise about how you do that. And I think as part of the wisdom of that is, as Kim said, it's a whole community approach. Use your power of convening to make sure that you convene the right people or actors in the community. For example, if you're concerned about the homeless population, many communities have a continuum of care for housing and homelessness. Convene that group on a specific reason on this. But an important fact is invite your local health department to that meeting as well, so that they're part of that. And advocate. I think part of it is we always have to keep in mind the most vulnerable and those people that are marginalized. And we as Catholic Charities need to remind decision makers at the local level and any level that we have to keep a certain eye and a very critical eye open to how are the most vulnerable impacted among us. So please think about serving, convening, and advocacy as three tools that you could use as you try to engage your staff, your agency, and the services that you do.
Great. Thank you very much, Brian. Okay, just to wrap up, thank you all for participating. Again, before we log off here in the next minute, you can certainly download that the attachment, which is the preparedness checklist, if you're interested in doing that. If you don't have time to do that, Simona will make it available on the members portal, or you can send us a note and we can send it to you separately. Also, the webinar itself will finalize and also be put on the members portal in by the end of today, correct? Mm-hmm. Yes. And we will also have a YouTube link.
Mm-hmm. We'll have a YouTube link that will take you directly to the recording.
Great. Thank you very much, everybody. We appreciate your participation.